The next presentation, post number 103, morbidity status and its association with the activities of daily living among the elderly living in informal caregiving settings in Colombo district. The authors are Vasalasantri S, Vijayaratna CN, De Silva SH, Wijesiri HSMSK. The presenting author Wijesiri SHMSK.
Good afternoon, everyone. First of all, I would like to thank SLMA for giving this opportunity to present at your Congress. This study is to determine morbidity status and its association with activities of daily living among elderly living in informal caregiving settings in Colombo district. So here, in the literature, it is mentioned morbidity is closely linked with activities of daily living. So here morbidity we considered having one or more disease conditions in elderly. So disease conditions such as hypertension, diabetes mellitus, heart diseases, arthritis, strokes, respiratory diseases, etc. And we considered 10 ADL activities of daily living. So we conducted this study in informal caregiving cities, that means in their own homes. This is a community-based cross-sectional study, and we selected 40 clusters of Gram Niladhari divisions. Divisions were selected using proportion to population size method, and each cluster consisted of 20 elderly people. We used validated Sinhala version of 10-item Barthel index to assess ADL limitations, and when coming to results, mean age of the sample was 72 years. 72% of them had one or more disease conditions, and only 16.9% had at least one ADL limitation. This chart shows that most of them were with hypertension, diabetes mellitus, heart diseases, and arthritis. When considering associations, morbidity has a significant statistical relationship with ADL limitations. Disease conditions like stroke, arthritis had a significant effect towards ADL limitations, and poor perceived health also associated with activities of daily living. Therefore, study concludes that morbidity having stroke, arthritis, and poor perceived health are significantly associated with activities of daily living, and therefore the study recommends to address the diseases that lead to ADL limitations to enhance self-perceived health and well-being of the elderly who are living in informal caregiving settings. Thank you.
Thank you. The paper is open for discussion.
Now you have compared the ADL limitations with different morbid conditions. So how was the ADL limitation defined? Was it having one limitation, or was there a score?
There's a score, sir. 100, it's out of 100. There are 10 ADL limitations, and each ADL limitations given 0, 5, or 10 like that. That means if it is independent, dependent, and partially dependent likewise. So out of 10, then total was calculated as 100. And then here activity limitations considered as having one or more disease conditions, and then so I categorized it like this and that, and then I used logistic regression to have associations and unadjusted and adjusted models.
So now you have used the validated version, and then was it validated to Sinhala by you, or was
no,
it
Professor Lekamasam validated it to the elderly Sri Lankan elderly people.
Thank you. Let's give a round of applause to the presenter.